Leukonychia is the partial or full discoloration of the nail plate on one or more fingernails or toenails. The nail will generally lose its pink undertone and appear white. Generally, white nail is not an alarming sign, but it can sometimes unmark severe systemic disorder or congenital condition. And then white, we should also know that white color of the nail can be due to nail plate or nail bed abnormalities. So now moving on to the classification of white nail or leukonychia, it can be classified according to the development timeline. So it can be congenital or acquired. So in case of congenital leukonychia, it's also known as familial leukonychia, and it is due to a mutation in the phospholipase C delta 1 gene, in which all nails appear milky and porcelain white. And whereas in case of acquired white nail, it can be secondary to systemic diseases. Now moving on to the another classification, that is pathological classification. There can be apparent leukonychia or true leukonychia. So to find out that, we need to apply the pressure in the nail plate to the bed. So when we apply the pressure to the nail plate to the bed, then if the pink color disappears, then that is a apparent leukonychia, and it is usually secondary to the disease of the nail bed. But if the pink color doesn't disappear even after applying the pressure, then it is true leukonychia, and this discoloration is due to abnormal nail plate keratinization. Now moving on to the classification according to the distribution, it can be total leukonychia, which means the whitening of the entire nail plate, or it could be partial leukonychia, which can be further divided into three subtypes, that is punctate, longitudinal, or striate. Now, moving into the causes of the leukonychia, it could be because of the traumatic cause like nail biting, manicuring, knocks and bangs, and tight footwear use, or can follow a more serious injury. And the other causes includes poisoning and drugs. Poisoning can be because of the heavy metal poisoning like lead and arsenic. You may also get a leukonychia, or also you can get a leukonychia with various drugs like chemotherapy and sulfonamides. Now moving into the other cause, it could be because of the systemic illness. In systemic illness also there are various types of leukonychia. One is terry nail, and in terry nails the nail bed look washed out except for a thin reddish brown strip near the tip, like in the picture, and it is usually associated with liver cirrhosis, chronic kidney disease, heart failure, hypoalbuminemia, which is due to protein malabsorption, example in colitis, or it could be due to protein losing enteropathies, diabetes, iron deficiency, anemia, zinc deficiency, hypothyroidism, or it could just be a sign of aging also. And the other type of nail that is present in systemic illness is Lindsay nail, and we can see it in the picture again. It's also known as half and half nail, and it has the proximal portion of the white nail and the distal half red, pink, or brown with a sharp line of demarcation between the two halves. And it has been associated with chronic kidney disease, psoriasis, allunyal syndrome, hyperthyroidism, pellagra, HIV infection, or it can even be present in a healthy individual. So now moving on to the diagnosis. For the diagnosis of the white nail or leukonychia, we should have to go for nail clippings to exclude fungal infection, or we may even go for a nail wax if you are suspecting any nail disorder, and also we need to do the blood test to evaluate this for the systemic disease, particularly renal and liver function test. And now this is a picture that shows a comparison between a normal hand, which is in the left, and the comparison of the hand with the white nail, which is in the right, and that the white nail hand has got a ring also. So let's see the video about the comparison between the two, normal nail and the white nail. So this is it for today. Thank you for watching.